Hello class, I'm Valentina Slaw, and today I will be discussing the breast cancer mortality rates in the special population of African American women. This presentation will encompass the details of some enabling characteristics, community risk factors, and other considerations, and some shifts toward this population in our healthcare today. Hopefully, by the end of the presentation, you will have an increased understanding of the depths of breast cancer mortality rates among African American women in the community and gain an understanding of the future directions targeted for this population. Breast cancer is a malignant tumor that starts in the cells of the breast. It is found mostly in women, but men can get breast cancer too. It is the most diagnosed cancer in women both in developing and wealthy or developed countries. African American women are more likely to be diagnosed with breast cancer at a younger age than white women. I chose this topic in population because breast cancer is the second leading cause of cancer-related deaths among women aged 40 to 55 in the United States and currently affects more than 1 in 10 women both wealthy and poor countries. Gabriel Reitlich states that if the world were 100 people, about 15 would be Africans. Following behind the 60 Asians in that 100 people population, Africans are the second leading in demographics, showing how important this population is against this disparity. Not only that, but the emphasis in Black women show that the statistics show that they are 42% more likely to die of breast cancer than white women. Although the mortality rate from breast cancer has decreased in recent years due to increased emphasis on early detection, there are more effective treatments in white populations. According to the Centers for Disease Control and Prevention, compared with white women, Black women had lower rates of getting breast cancer and higher rates of dying from breast cancer between 1999 and 2013. The reason for this disparity is likely due to several factors, including genetics, the biology of cancer, and differences in healthcare. Dr. Suzanne Affollo, an advocate for the Breast Cancer Suzanne Komen Foundation, states the focus is shifting on addressing the compounding social, cultural, financial, and geographic barriers that continue to confront African American women, regardless of their insurance status. One of the biggest environmental factors is that women of color put their kids and their husbands first, but are not making themselves a priority. Late-stage diagnoses indicate that African American women are not going to get checkups early enough or often enough. Scientific studies have identified possible differences in biological properties and especially in the plasma levels of growth factors and hormones, reproductive factors, including the presence and expression of steroid and growth factor receptors, tumor receptors, and chromosomal abnormalities between African women and white women. These possible differences in biological properties between African American women and women that are white have the potential to influence breast cancer screening and treatment outcomes between the two ethnic groups. Racial ethnicity disparities in breast cancer mortality rates are not completely understood, but the common risk factors include socioeconomic status, differential access to healthcare, and disease-related molecular mechanism differences. Recent reports demonstrate that African American with breast cancer have a poorer prognosis compared to non-Hispanic whites when diagnosed at a similar age and stage. Several reports have demonstrated that African American women tend to underutilize genetic counseling services and have underscored the importance of tailored outreach educational strategies in order to improve the rates of African American women in genetic counseling programs. Several strategies, including early detection and diagnosis, reduction of tobacco smoking, widespread of cancer breast screening, have been developed to improve the health of patients with breast cancer. Although there has been an improvement in early detection, many Black women are less likely to get better treatment compared to white women. Therefore, new strategies and approaches are needed to promote breast cancer prevention, improve survival rate, and ultimately improve the health outcomes of racial ethnic minorities. Black women are not taking action. While 92% of Black women agree breast health is important, only 25% have recently discussed breast health with their family, friends, or colleagues, and only 17% have taken steps to understand their risk for breast cancer. Black women lack information about the severity of breast cancer and the need for screening. Black women often don't have access to the same prompt, high-quality treatment that white women have. They express that they often feel disrespected by physicians and staff. The concept of vulnerability to this healthcare disparity connect with how Black women take care of others at the expense of their own health and are susceptible to a high level of vulnerability. The accessibility and quality of care is present, but Black women may not have access to health care or health insurance, so may have lower frequency of and longer intervals between mammograms. Public health agencies are working to make sure all women are screened for breast cancer as recommended, and those who are diagnosed with breast cancer can get the best treatments. They also are helping women reduce the risk factors that raise their chances of getting breast cancer. Together, these efforts could reduce racial disparities in breast cancer. Advocates like the Susan G. Komen Circle Promise, a group dedicated to more positive outcomes when it comes to Black women's breast health, are creating projects like bringing mobile and free mammograms to low-income neighborhoods and raising funds to garner resources to combat the barriers between the breast cancer disparity. Now for the discussion questions. Number 1. Discuss how racial ethnicity disparities and breast cancer mortality rates can be approached with telemedicine. 2. How would regular clinical breast exams in the Black women population affect healthcare cost?